progressing malignant or a space-occupying lesion or a metastatic tumor to bone marrow. So any tumor in bone marrow, being primary or metastatic tumor, can cause this increased bone resorption or immobilization for a long time. When a patient is immobile for a long time, he is at home due to bone break of any bone, this increased bone resorption can be seen. Also, there are some diseases that there is, again, more calcium removal from bone, such as Paget's disease. So there are different causes that there calcium is removed from bone tissue, and there is hypercalcemia. Vitamin D disorders. Such as vitamin D intoxication. Some diseases such as sarcoidosis, where the receptor, vitamin D receptor, is abnormal. And renal failure. Renal or kidney failure, where there is increased retention of phosphate, and this retention of phosphate causes increase in this PTH. So here, renal failure of any cause can cause increased phosphate retention and then increase in parathyroid hormone and hypercalcemia. There are also some other causes that can cause hypercalcemia, increased calcium consumption. Also, aluminum in some drugs can cause hypercalcemia, and that is used, for example, in antacids for lowering gastric acidity. So these can be causes of hypercalcemia. And I said that the tissue is healthy. This hypercalcemia causes calcification in the interstitium, not intracellular. In the interstitium of some organs such as kidney, stomach, lung, and arteries and veins such as pulmonary artery and vein. So it can be this type of calcification, metastatic type of calcification, is seen in the interstitium. Of kidney, stomach, lung, and vessels. And these are different organs, but have this common thing that they excrete acid. Excrete acid in stomach, in lung, kidney, and here. So this excretion of acid causes an alkalinity inside the tissues, and this increases the probability of calcification. So, and it is in the interstitium between the cells. And this calcification can give no dysfunction to the organ, but sometimes it can give, such as calcification in the interstitium of the kidney causes nephrocalcinosis. And this can give problems. Also in lung tissue, calcifications can be seen on X-ray and radiography. We can see some calcifications. In the dystrophic type of calcifications, I said that calcification is seen in unhealthy tissues, necrotic tissues. So it can be seen in some type of necrotic infections, such as Mycobacterium tuberculosis, that gives what kind of necrosis? In the caseous type of necrosis, calcification of the, which type can be seen, metastatic or dystrophic? Dystrophic, because the tissue is necrotic. And so in TB, Mycobacterium tuberculosis, which causes caseous type of necrosis, we can have dystrophic type of calcification. And the lymph node of the patient can become totally calcified and become like a stone, have a consistency of a stone. Very hard due to calcification. And also this calcification can be seen in some cancers, such as breast cancer, that on a radiography some areas of calcification can be seen. And there also the tissue can be very hard on sectioning. These types of calcifications are dystrophic type because the tissue is not healthy. So note the differences between the two types of calcifications, and the level of calcium of serum, which is normal in the dystrophic type and is high in the metastatic type, and the hypercalcemia is the cause of calcification in metastatic type of calcification. Now after the calcification, we do the last part of cell injury, which is the cellular aging. The cells age as we are aging, and maybe aging for most of the people, its importance is just a cosmetic importance. But aging is much more important because all the chronic diseases and malignancies are closely related to aging. All the chronic diseases and cancers are seen in aged people. So it seems that aged cells are not normal cells, have some problems that it predisposes the cells and the human being to different chronic diseases and cancer. If you study any type of cancer, you will see that it is seen in aged people. Just few tumors, cancers are seen in pediatric patients. There are, but
chronic disease doesn't
not,
make sense.
not acute. Acute and chronic. If a disease is prolonged, it is with the body for a long time, it is called chronic. It's Persian and maybe Arabic is muzmen.
Yes.
And acute is hot for just some days, some weeks, it will be acute. Hot muzmen. And muzmen is chronic. It's a prolonged disease that may be a lifetime, such as rheumatoid arthritis. It is with the patient for a lifetime, and it gives its different complications. And also cancers. Now, what is the cause of cellular aging? The cells cannot proliferate unlimitedly. So our cells proliferate in a limited manner. if you put some live cells in a laboratory and culture them, you will see the maximal growth and proliferation of these cells only for maybe 1 week. And then after some days, these cells start to die. They have a limited ability of proliferation, and this is called senescence. Senescence is the ability of a cell to proliferate. It's a fixed number that, for example, a cell can divide for 50 times, and then it dies. In different cells, this ability is different. Some cells die easily, sooner, and some cells live longer. So senescence is the ability of a cell to proliferate and then reaches some time that it cannot proliferate and it becomes senescent or dies. And what is the reason of this senescence? There are two concepts of senescence. So this is lack of proliferation. Lack of proliferation of cell. So senescent cells are dead cells. They cannot proliferate, they cannot divide. What is the reason of senescence? One of them is telomere attrition. And the other is activation of tumor suppressor genes. What is telomere attrition? This concept shows the importance of a repeated sequence of DNA that is present on the ends of chromosomes. You see, this is a chromosome. Imagine this is a chromosome. At the ends of these chromosomes, we have telomeres. So telomeres, as a cap, they keep the other parts of the chromosome healthy. They don't let any breakage, any mutation in other parts of the DNA. So telomeres are repeated sequence. Imagine some nucleotides as A, T, G, G. So these are nucleotides. Adenine, adenine, thymine, thymine, guanine, guanine. So this is a repeated sequence, and it is repeated for example, 2,000 times in the telomere. So this is one time, and this A, T, T, again A, T, T, G, G, A. That's why we say repeated sequence. Telomere is composed of this repeated sequence of DNA. And this doesn't let any damage to the other part of the chromosome. So for having a better action, this telomere length should be stable. If this telomere has this length, telomere length, if its length is stable, the cell can proliferate for a very, very long time. But the problem is that in our somatic cells, our cells are somatic cells. We have somatic cells, germ cells, which are the sex cells from the mother and father. They are N. Somatic cells are 2N. So 2N chromosome, N chromosome. Germ cells, somatic cells, and stem cells. What is the difference between these cells? Somatic cells cannot proliferate forever. Why? Because this telomere shortens in length by each division. So imagine if this length is 20 kilobases, thousand bases. This reaches to 5 kilobases by different proliferations. And the shortening of the length of telomere increases damage risk to the chromosome. So our somatic cells have telomeres, but nothing protects these telomeres. That's why with each cell division, the length of telomeres decreases, and these telomeres, somatic cells, have a limited life. But there is an enzyme called telomerase, which is an RNA protein complex. Telomerase, an enzyme which is an RNA protein complex. It makes telomere, but not in somatic cells. Somatic cells don't have telomerase. Germ cells have telomerase. Germ cells, the cells that make the zygote, and the zygote becomes 2N and proliferate. And then somatic cells develop. So germ cells have telomerase. And that's why germ cells have a very long life. And stem cells. Stem cells, what are stem cells? Have you ever heard of stem cells? Stem cells are cells that can differentiate to many cell types. So a cell, it's a mother cell in, for example, bone marrow. This can make many types of other cells. It can make neutrophil, it can make platelet, it can make white piece, leukocyte, other types of leukocytes such as lymphocyte, red cell. So one type of cell can make different types of cells. It's a stem cell. Stem cells also have telomerase, but not as much as germ cells. So stem cells also live longer than somatic cells. If you imagine this is telomere length, and this is cell division. These are germ cells that their length is stable due to the presence of telomerase. These are germ cells that their ability of proliferation is not decreased. But these are our somatic cells that by each cell division the length of telomere decreases, and so they die. They reach a state that they are senescent. Means that they die. But the stem cells are something between these two stem cells. They have some telomerase and they live longer. But in somatic cells that become cancerous, cancer cells, not like stem cells, but again they live a long time. Cancer cells. Why? Because cancer cells have telomerase. Cancer cells, again, they achieve telomerase. So if a somatic cell becomes cancerous, then unfortunately it can divide for a long time and it is immortalized. it doesn't die easily. It proliferates and proliferates. So one of the causes is the presence of telomerase in cancer cells. So this is the concept of telomere attrition, means shortening of the telomere that causes senescence in somatic cells, but not in germ cells. The other concept that causes death of cells or senescence is activation of tumor suppressor genes.
Doctor, in stem cell, we don't have cancer cell.
Yes, in stem cells, it's said that in most cancers, stem cells are the cause of cancers.
But you said in.
Stem cells can also become malignant. They have telomerase. This is for explaining cellular aging, but it doesn't mean that stem cells don't become malignant. Stem cells are also a very hot research area for discovery of different types of cancers. It's discovered that many types of cancers, they originate in stem cells. Now I explain the tumor suppressor genes. There are two kinds of genes that have different actions contrary to each other. One of them is tumor suppressor genes, the other is oncogenes. Oncogenes, their activation causes cancer, but tumor suppressor genes prevent cancer. So the second cause of senescence is activation of tumor suppressor genes. So the duty of these genes is to prevent tumor formation. How? By arresting cell cycle, and by apoptosis. So if you remember the cell cycle that is G0, some are in G0 phase, some cells are in G1 phase, they start division of the cell, G1S, G2M, this is mitosis. So this continues. This is the cell cycle. This S is the synthesis of DNA, and M is the mitosis, where one cell becomes two cells. There is one cell here, then at mitosis it becomes two cells. And G1 and G2, as I explained you on the first session, it's the part of checkpoints where there are some genes that check the cell cycle. If there is a problem in cell cycle, if there is a damaged DNA, mutated DNA, the cell is not divided. When it stops the cell cycle, it is called arrest. If it's there is no problem, the DNA is healthy, so the cell cycle continues. But if some genes sense that there is a problem in DNA, and the cell, if the cell is divided, an abnormal cell will result. So these genes have the duty to arrest, to stop the cell cycle. This is the duty of tumor suppressor genes. So tumor suppressor genes, if function normally, we will have no tumor cell. But in some patients, due to different causes, as physical, chemical causes, such as radiation, or some genetic causes, they don't have normal functioning tumor suppressor genes. Thus, there is no gene to prevent any type of abnormal cell cycle, so we will have different and proliferated abnormal cells. So, two very important tumor suppressor genes are P53 and RB, retinoblastoma, P53. This tumor suppressor gene, P53, imagine that it is mutated in more than 50% of all cancers. So abnormal cells are proliferated and tumors are seen. And another is RB gene. In the concept of senescence, due to activation of tumor suppressor genes, there is a gene having the locus CDKN2A. Genes have different names. Imagine this is a chromosome. There are different genes on the chromosomes. And each gene has a name and has a duty, does something. So on chromosome, it's chromosome number 17. There is a gene called CDKN2A. It has two parts. This CDKN2A has two parts. One of them is called P16 or INK4A. Since there are many genes, many proteins, that's why we have many complex names. P16 INK4A and the other is P14. P14. This one, it expresses this RB gene and then RB protein. This RB gene. RB gene has the duty of cell cycle arrest. Arresting cell cycle. So one of the causes of senescence of cell death is activation of this gene, and especially this locus, P16INK4A, that increases cell cycle arrest. When our cells age, the activation of this gene is increased and it causes cell cycle arrest. It reaches a time that this gene doesn't let any cell to divide. So the next important thing as a cause of senescence is activation of tumor suppressor genes. There are many different names, so if you don't want to have problem, you should study every time, because when you read, you think that it's easy, but then easily you forget them. After senescence, so cellular aging has one of the causes is senescence, and the other is DNA damage, and the other is protein damage. We have talked about these things in DNA damage and protein damage in cellular injury. When a cell is proliferated, is divided, it means that the DNA is divided. And with each division of DNA, there are some breaks in the DNA, there are some abnormalities in the DNA that should be repaired. So normally there are some repair enzymes. Normally there are some repair enzymes that do this. It means that when it sees that some part of DNA is broken, is abnormal, they repair it. So we normally have these kinds of enzymes such as helicase. And due to environmental causes being physical, chemical, being radiation. These repair of DNA is damaged, and we will have damaged DNA. But there are also some diseases that the helicase is deficient, such as Werner syndrome. These patients age sooner than normal people. So in Werner syndrome, helicase is deficient, so there is no DNA repair, and these patients look old. Also other diseases such as Bloom syndrome and ataxia telangiectasia. These are other genetic syndromes in which they don't have the special proteins important in DNA repair. So one important thing in cellular aging is the accumulation of damaged DNA in cell, and then again it reaches some time that these accumulation doesn't let the cell to proliferate and the cell dies. Other cause is protein damage. If, as you remember in cell injury, causes of cell injury in apoptosis, protein damage causes misfolded proteins. And there are some systems inside the cell that they degenerate abnormal proteins, aged proteins. This is I explained you the chaperones, the ubiquitin, proteasome system, and the autophagia lysosome system. These systems have the duty to disappear, to degenerate abnormal molecules. When our cells age, these systems cannot work normally. If you remember, the chaperones were small molecules on the polypeptides that gives the proper folding of the polypeptides. And the ubiquitin proteasome is the small molecules of ubiquitin attached to polypeptides and then inserts this proteasome system and is changed to very small fragments. And in autophagia lysosome, that, as I explained you last time, cell components are eaten by the cell itself through this process of autophagia. So one of the causes of cell aging is protein damage. That accumulation of abnormal proteins and misfolded proteins causes cellular aging and cellular death. So these are the three important causes of cell death. But also there are some things that increase cell life, and they can prevent aging cells. One of them is insulin, and especially insulin-like growth factor 1 system, and the other is sirtuin. The insulin signaling pathway, if it function decreases, or if these sirtuins are activated, then it prevents aging. What does it mean if this insulin pathway function is decreased? It means that if we eat less, if we have calorie restriction, we eat less food, then the cell will have less calorie, less protein to degenerate them, to work with them. So at last, if this happens for a long time, the cell can live for a longer time. So the concept of eating less, called calorie restriction, eating less food causes decreased functioning of this insulin-like growth factor 1 signaling pathway. Its beauty is insertion of growth factors and insulin inside the cell to activate the metabolic pathways. So if this pathway function is decreased, then the cell has more time to renew itself and there is less waste material. And also sirtuins are some molecules that regulate the proteins of aging. And if they are also activated by less eating. So these two can prevent cellular aging. This picture is for the previous edition of this book. These question marks are the sirtuins and the insulin and insulin-like growth factor, that they prevent aging cells. So these two, remember, if you see a question that which one of the following options increases aging, these two decrease aging of cells.
But
And
doctor,
the important concept of calorie restriction or eating less food.
but doctor, you said sirtuin is
Sirtuin,
sirtuin. It's
regulator
no
of
by
aging cells.
by eating
Less eating.
less eating, it increase.
It's
But
activated.
how?
It's not
How it will
very,
be increase the aging? So,
everything is not clear here. Just now, it's a new topic to research. So, also in the book, it says just in some sentences for a paragraph. But if you want to go into detail that how they do this, you can present. You can choose this as a presentation for yourself. Search the internet in the NCBI, which gives many publications, and find how sirtuins prevent cellular aging. Sirtuins have different molecules such as sirtuin 6, and there is the possibility to have new tablets called sirtuins that we can use them as anti-aging tablets. But if you want to, you can explain us the mechanism of action of these molecules. So this is the chapter of cellular, finishing the cellular chapter with explaining cellular aging, which also has some complex things to memorize. It's finished. So next time we will continue the other chapter of Rabin's inflammation.